Good afternoon, all, and welcome to this webinar on alcohol, drug, and substance abuse. To take us through this topic today, we have two experts. We have Dr. Violet Okech, who is a chief medical specialist psychiatry and chair to the ADSA committee, Kenyatta National Hospital. We also have Mr. Richard Odero, who is a counseling psychologist and the head of the Employee Assistance Unit at Kenyatta National Hospital. And I am Eric Wangaji, who is the moderator of the program. Welcome, and could we have Dr. Violet to start us off?
Thank you very much, Mr. Wangaji. Can I go ahead?
Please do.
Thank you so much, Mr. Wangaji. Thank you, everybody, for taking time out of your busy schedules to join this very, very important webinar on the matter of alcohol and substance abuse among healthcare workers. We know we are stationed at KNH, but we work very closely with KMTC, University of Nairobi, and other bodies. And we actually have an employee assistance program. The other day I went to a ward in the hospital and I was telling them about how we have an employee assistance program, and they were not even aware that that program existed. But I believe that is the exception rather than the rule. And Mr. Odero, who is our counseling psychologist with his team at the employee assistance program, are doing a great job of helping staff members navigate good times and bad times, and also navigate habits or activities that they engage them that might not be good for their health. We know that worldwide, many people use alcohol and other substances to relax their minds and their bodies, especially when they're stressed or after a long day at work. But when that substance now begins taking over your life to the extent that you can't function at home or at work, or you're not able to go to work without, taking a tot or a drink in the morning or taking a puff of something, it means that now the alcohol and substance have now entered the realm of abuse. So we're very excited that Mr. Odero has chosen this very important topic. He wants to enlighten us on various aspects of it, how to identify, how to manage, how to cope, healthy ways of coping, and many other wonderful surprises that he has in his presentation. With these few remarks, I invite Mr. Odero to join us and to give us his presentation. Asanteni for joining us.
For that wonderful introduction. We are going to focus on the impact of alcohol and drug substance abuse among healthcare workers. And based on that, we are going to look on the psychoactive substance and the negative effects. Based on that, we all know what psychoactive substance means and the effects. So the substance misuse could lead to substance use disorder, which again will require treatment. And through employee assistance program, you find staffs coming with the issues related to drug substance abuse, and they are clouded with a number of psychosocial issues and challenges. And for today's discussion, we'll only majorly focus on the mental wellness. And you find that the mind, all those components of these substances used are saturated in the mind, as you can see there. And you find, because of the addiction bit of it, the staff or the user is changed. And you find to an extent they are craving for it. They do self-medication. And just to be brief on that. So alcohol and drug substance abuse over years, record shows high cost of addressing mental health disorder and other related diseases. Also in our families, we have challenging issues due to alcohol and this substance abuse. Also, you realize that economy is also affected, and so many others which are just associated with alcohol and drug substance abuse. So again, when we look at the psychotropic substance, we can just mention the names. Those are the ones available in the market or at in the medical care. You find those components are available, and if misused, they affect us negatively. So based on that, the threats which are there as an impact is a general customer care. That is mainly here we are focusing on patient, but even other extended customers will be affected negatively. So substance misuse by healthcare workers or healthcare professionals raise many concerns, since we are for the wellness of our customers or patients. And when the service provider is under influence of the substance, the job done might not be promising. Then you find that due to circumstances, you find a number of healthcare workers in their respective areas, mostly in stressful working environment, resort to do self-medication to keep them high or low, so that they keep on working, which again, at the end of it, might affect them negatively if not checked. Then those who comes to employee assistance program do self-reported about use of substance abuse based on their own analysis and appraisal, having realized that they are struggling in their life with their normal psychosocial life challenges, and they come for help. So based on that, it is very key to note the challenges which are there and how we can navigate about. So we are not going to look into how the alcohol and drug substance abuse repo in a broader perspective, but we narrow it to self, then we link it to workplace. So you find that when somebody is using this substance, the person will be affected negatively, then the workplace also will be affected. And with that will take us to look at the substance use disorder risk. What are the risk factors that are exposing, and the protective factors which can be used to do this. Then we have shared risk also is there, and the protective. Then again, we have the mental issues that are related and the protective. We are not going to venture deep into this because this is an area which many have researched on, and we all know what it entails. So to conclude on that, we can say there is a general negative view of the physicians, and this hurts healthcare workers, service provider, patient relationship, and hinder patient action, such as on following the care plan. That is in treatment, it have a negative impact. So this replicate to harmful effects and even the reputation of oneself and to the institution. So we have to be cautious on that. And if you have to drink or use this substance, use them responsibly. So based on that, we can see a number of these are just a few how alcohol and drug substance abuse affect us physically and in the behavioral. It affects us negatively, and there are the signs that are shown. Also, there is also unexplained and frequent absenteeism and even lateness to work. Then we have reduced work performance, also sudden mood swing, frequent illness or health problems. Also, we have poor work relationship, the interpersonal relationship at the workplace, increased financial problems, maybe taking loans and so forth. You can think in that direction. Also, there is recurring incidents of theft. This is to maintain the drinking or the use of this standard, this substance. Since they are costly, some are very costly, and for you to maintain, you need money. And because you are in a financial crisis, you will develop a habit of stealing, maybe at workplace and even at home. Also, this one lead to a cost of substance abuse in workplace. You think of discipline cases and so forth, and even absenteeism, and even sickness. By the time you are being treated, it comes with other costs. And that one will lead to reduced productivity. Insurance also is there. And also we have that need that you have to go for detox. And if there be need, you have to go for rehabilitation. So to be brief, it affects, we look at the employer side, and on the employee side, we'll not go to the society and even to the family, but we'll touch family briefly. So for the employer, as you can see there, those are the negative effects that will come. And on the employee sides, those ones you can see they are there. Finally, what we are not going to touch is the instability in the family system. So you find an argument, and this again also interfere with the well-being of the family. I'm just rushing over since it is self-explanatory. Then what are the predisposing factors that are there? There are many, but we may focus briefly on risk of psychosocial problems. And this one can be seen through behavioral patterns, mental disorder, and breakdown of family systems, poor relationship strain, peer relationship strain, recreation, and work maladjustment. So these are the avenues that you find one can graduate into this or introduce themselves to this substance abuse. Then we have the medical professional suffers from extreme work responsibility. And this one, if they don't know how to cope with it, the physical pain, the sleep deprivation due to the work overload and so forth, our area sometimes the work is demanding and there is a lot of pressure. It comes with a number of things, fatigue and the work related stress, stemming from constant also exposure to illness, the death witnessed, and even traumas, which again, we are not going to focus on that. It will lead to vicarious stress disorder, which again, if not attended to, has a negative impact in the healthcare fraternity, then healthcare workers turn to substance use as a form of coping mechanism and self-medication, which eventually lead to codependency and addiction. So we encourage staff, when you have an issue that you are undergoing, seek for professional support, and we have various arms of supporting staff. So don't sigh off instead of doing self-medication. So in treatment, the employee assisted program offers staff with counseling services. We do follow up. And the aim of doing this is to assist the staff to understand and to clarify issues that are directly concerning them, including any underlying issues, and also to help them identify and explore options to address those issues, and develop plan to approach the issues at hand and find a constructive solution. So it means it will be a process. It is not a one session thing, depending on the issues you have. So it is a process. So employee assistance programs also provide the following benefits. And that one is for both the employer and to employee. Performance will be improved. There will be decrease in lateness, and there will be efficiency. Morale will be improved, and a number of, you can add, the list continue. So in treatment, when you come to employee assistance program, it is important to acknowledge that failure is just a success in progress. So we learn through mistakes. So it is not to blame yourself or do the negative talks, self-talk. So one of the things it is very important to mention is that employee assistance program, we don't pressurize people, but we operate on the principles of self-motivated, self-referral, and self-commitment, because you know exactly what is tying you, the chain that is holding you back, and where you want to go. So it is upon you. And this one will take us to a level where you need to develop at least 12 ways of overcoming your life challenges. And by that, you will come to self-realization. And that one, you will give applause to yourself and say whatever you want to say to motivate yourself. As you can see there, I give myself permission to do what is best for me, to love my whole self completely. So it is upon you. If you don't love yourself, who will love you? You have to love yourself most. Then this one will take us also, based on that, will take us to a level that what we achieve inwardly will change into your outer reality. So it means what is going inside you, even though you come, we give you support at workplace. If you are not ready to change, your own maker of your destiny, and you make your own reality. So you have to be responsible in this journey of recovery. And through that, with us, we are very objective. We listen to you, we guide you. We also, where necessary, we give advice. So Based on that, what does employee assistance program do or does? At employee assistance program, we might look at 3 areas. One, to look at you as employee, as a staff, as an individual. What are you exactly aiming at? What are you going through? Then we look and discuss with you what kind of assistance do you need, because in your life, maybe you are going through stress. So with that, we'll link you to the programs of stress management. If it is health issues, we link you to areas how to manage your health. If it is a family, we look for how to help you in that line. If it is emotional, all those, but today our focus is on substance use. So those are some of the programs that we can say in brief. So employee assistance is just to energize you to handle your life issues. And the magic is at your hand. If you live in denials, then again, it is not for your advantage. You have to own you have a problem. So in the treatment, we employee assistance program, encourage periodic training, and here employee assistance program do conduct, like the one we are doing, trainings and motivation talk to healthcare workers on associated risk with substance use. Then holistic approach to handle substance treatments. And when we talk of a holistic approach, you will realize that there are times that need administrative decision. We suggest that also administratively it should be approached. Where it needs treatment, it will be meet the treatment. And just to mention, employee assistance program, we offer free services to our staff and to their nuclear family members. But when it moves to other treatment, they come with cost. So you have to bear that in mind. And that is what it needs, holistic approach, where now the financial implication is involved, it has to be discussed. Then again, we encourage health care workers to make use of any available developed local network for professional peer support. We all have in our areas of work, we have our groups of supporting one another. And you know in which profession where you are, like for the counseling and psychologist, we fall under the mental health, and majorly we do have supervision, and we do have that forum where we check on one another, how was the day, maybe the challenges and so forth. It is very key to take note on that. Then implementation, you find that that this one now goes to employers. They should observe periodic reports on how substance abuse or misuse is trending and the impact which within and outside. So it means when we go back to that where we are talking of the how alcohol and drug substance abuse is tripling in our society, you find that it affects us beyond yourself because of the connectivity, and it moves even globally. So to conclude on that, we talk of team work spirit. We encourage healthcare workers to be supporting one another. We are at different levels and we are undergoing different challenges. Some are more advanced in handling these things. Some are less experienced. So in case you see a colleague struggling, it is important to suggest for them or guide them where necessary. So on this now, these are the treatments we have. And in the treatment, we have the measures. And the measures which we have are in place. Employee assistance program, one thing, encourages self-determination. And through self-determination, we'll be providing counseling. And through providing counseling, we encourage staff to own their challenges. Where necessary, we make referrals, and also where necessary, we also encourage group support, because you may be undergoing through same challenges, and there we'll encourage that we form a group to handle that and encourage one another. Then again, the treatment, we should agree with the client, in line with the client need or the staff need, and to handle the specific substance use or the issues which are there, meaning that each substance needs a different approach or need different treatment. Those needs detox need detox. As we had mentioned that we are only measuring on the mental, but you find that there are other body organs that can be affected. So that again, link us to take you to the relevant where you can get the treatment. Then we talk of the education. On the education side, we encourage comprehensive training. And with the comprehensive training, it will help the staff to recognize the signs and symptoms they themselves might be going through, or their colleagues. So with that, will help to manage them at an early stage. Then also it is important to campaign for regular awareness. This one can be done at a lower level in the departments. Also, maybe employee assistance programs can be called to offer those services. Service providers can be called to offer those. Then also, employee assistance program will also engage staff on a healthy coping mechanism and stress management. Also, based on that, early intervention and screening. Through mental health, it is important to mention that we have screening tools. And through these screening tools, we identify the areas of potential substance abuse issues that align. Then also, we encourage peer support programs to encourage early intervention. We encourage peer support. Mostly you find that before it comes to your attention that you are moving in a negative direction, you will realize that the colleagues whom you are working with might have observed this for a long period. And if we are open enough to talk to our colleague and bring it out, it will help them. Then again, it is important to offer supervisory training, because you find the supervisor is the one who is abusing the substance. And it is important to note that this substance, when you use them, they affect your brain. And as we had mentioned, the decision you are making could be rational, or you make wrong decision. So, and again, this will affect the employees. And this, when we do this, will bring a general behavioral change among employees, covering all cadres. What are the treatment options that we have? We have individual therapy, and individual therapies, we have various approach, like cognitive behavioral therapy. We have motivational interviews, and all this and other based therapies that are there to help us handle the issues, underlying issues of the substance abuse. Also, we can also have a group therapy. Under group therapy, we encourage staff, maybe you are struggling with this. We encourage you to join groups like the Alcohol Anonymous, AAA, and also the Narcotic Anonymous. You can also join those ones. And you, from there, you get support from one another. That is the peer support. And it is important to note that accountability is very important on specific cases of addiction, because addiction, it is important also to mention that it is a disease. And when it is a disease, the addictee is really struggling to live this, but how to come out is a challenge. Remember, they are chained in it. So here we recommend where detox is needed, necessary, we recommend for detox, and where rehab is needed, we recommend to go for rehab. Then there is also monitoring and follow-up. So we do regular follow-ups, particularly on staff that have gone through sessions, how they are doing in department. But since consider the population, it is important that we team up from the departmental or from the working area. It is important the in-charge should be very supportive, doing the assessment how, and even encouraging the staff, so the staff may feel valued and being included, not being blamed all the time or given different names. So it is important to monitor the progress of a staff that has been undergoing treatment. And this is important to help us in reducing the risk of relapse. Then clear policies of return to work procedures should be there. You realize sometimes one has gone through rehabilitation or treatment, and handling patients, to be precise, we could still have an issues, or he can still have an issues. So what we can be done, we can monitor this and give the colleague a support as he come to normal without judging the staff. Then also workplace policy and follow up. We can talk of there should be clear and enforced policies regarding substance abuse and the consequences and non-compliance. And this one is when staffs come to employee assistance program, we normally bring this to their attention that there are policies guiding on drinking, and nobody is against their drinking, but they know that it comes with a cost, and disciplinary could be taken Also, the bit of confidentiality is very important to protect those who are seeking treatment. There is something that has come up that those people who are undergoing treatment, some are experiencing stigma, being looked down, and being discussed and being seen as of no worth. It is important to look into that. If you have a colleague, be supportive. Remember, it is a disease, and a disease can fall into anybody. And this is with due respect to you, remember, we have even doctors who are also in this category. We have even counselors and psychologists who are in this category. So with the disease, it doesn't care who you are. If it comes, you will have to go through treatment as any other. And this, what does that mean? Even if you are a doctor and you are realizing that you are going in a wrong direction, it is important to seek for treatment. Then the reporting procedures for suspected substance abuse, this one include appropriate disciplinary. The disciplinary which is there is to make the addicts to own their problem and to reform, not to harm them, but to make them realize that they need to reform. The society needs them, the employer needs them, their family needs them, so they need to own and reform. On that, to conclude, we check on areas of consideration, which are, again, I've mentioned there, is the stigma reduction. This one, if we can work on that, many will come out and many will be utilizing employee assistance program. And based on that, you realize that still we need a tailored approach. And in the tailored approach, it is important to recognize what are those stressors that are there and what are the treatment that we can give to those things that are stressing us in the working area that could lead us into wrong direction. So to conclude, it's just sorry for that. To conclude, it's just employee assistance program is open for you. We are there to journey with you to go and overcome your normal life challenges. We listen to you, we care. Welcome.
Thank you, Bonodero, for that detailed and wonderful exposition on the alcohol, drug, and substance abuse and the risk factors associated with the same and the treatment thereof. Dr. Ketch, before we get to the question and answer session, could you kindly elaborate on the effects of this alcohol and substance abuse on medical personnel or the healthcare workers, as it were? And secondly, probably you could say something a little bit more on what drives healthcare workers into alcohol, drug, and substance abuse. And lastly, I know you are quite knowledgeable on this. Could you kindly give the clinical angle to the treatment thereof? Dr. Ketch, please.
Thank you, Mr. Wangaji. You've asked me 3 questions at a time. Let me handle one at a time. Firstly, a big thank you to our counseling psychologist, Mr. Odero, on that comprehensive, talk about alcohol and substance abuse, and what to do, how to realize that one is addicted or one is in danger, and methods of coping healthily. First, I'd like to say that we are all, the ways our brains are wired and our bodies, we are wired to survive and also to move towards things that make us happy. So if you have experiences, and different people have got different coping skills and different levels of resilience. Now, Mr. Odero told us several times that addiction is a brain disease, and one is more likely to get addicted to alcohol or substances, other psychoactive substances, if you have a genetic predisposition to either depression or anxiety, if you have suffered at what we call adverse childhood experiences, if you've gone through trauma, and that one we're talking about your growing up years and even as an adult. And then also the other thing is that in the medical world, as Mr. Odero pointed out, it's a high stress job because you're handling life and death issues, and you are handling people when they are at their lowest. Many of our patients, you are seeing death, you are seeing trauma, you're seeing blood, you're seeing injuries. And also many a time, I think many hospitals are understaffed. I don't think we've reached a point in Kenya where we can say all our hospitals are, fully staffed in all levels of cadres. Now, on top of that, you might then find that you're going through things at work that you might not be willing or able to discuss with your significant other or people at home because it might re-traumatize them. So that thing that Mr. Odero was talking about, having peer support in terms of looking out for one another in the departments where you work, in the units where you work, in the offices where you work, and also having one or two people who you can actually just confide how you're feeling and what you're going through. And also for those in management to develop a listening ear or to continue having a listening ear to those that are around them. And also we know that the higher you go in an organization, the colder and the cooler it becomes. You might be the CEO or somebody in management, and you are the one who's having a problem with alcohol or substance use addiction. You need to have people around you who can act as your mirrors at your level, and with whom you can be able to share what you're going through, and perhaps ways in which you're using alcohol or other psychoactive substances that are not healthy for you, so that you're able to get timely intervention and treatment. Now, from the medical side of treatment, the treatment for addiction and substance use begins with self-awareness. Many times people are referred, but one also needs to be self-motivated in terms of one needs to come to an awareness that their use of those psychoactive substances, whether it's marijuana, whether it's cigarettes, cat, kuber, alcohol, has now reached a point where the drug is taking over your functioning, and your daily activities are geared towards obtaining this drug and making sure you have enough of it, to the detriment perhaps of your relationships, to the detriment of your work, to the detriment of your sleep. At that particular point, then you need support and treatment. And treatment normally we have a 10 to 14 day detox period. We might ask, why can't we just do it over 2 or 3 days? Because the brain is a complex organ in your body, and it takes time for your body to be able to, first we take you through a detox process, they're able to flush out the substances that are within your system, but also to realign your nervous system so that you're not as dependent on these substances as before. And on top of that, we always work very closely with our counseling and psychological teams so that we are able to train somebody to develop new ways of handling stress, new and healthy ways of coping with triggers, and also raising of self-awareness and ways in which they can take better care of themselves. You might find that depending on your environment, on even just your temperament, because we all have different temperaments. There are people who are easy and cool, there are people who are more outgoing and things like that, and different people handle stresses differently. So being aware of who you are, what works for you, what are your strengths, what are your weaknesses, what are your common triggers, how to deal with them, and also things that learning to choose your battles, because sometimes you are in a work environment where you cannot really, let's say, be transferred to another area. And there are things that you can modify in your response to triggers or in the way in which you interact with other people that will help you to function better. Medically, we know that persistent heavy use of alcohol, let me take alcohol as an example, can lead to pancreatitis, can lead to your pancreas getting inflamed, and it can actually lead you to getting diabetes. And we've seen this especially among young men between ages of 25 to 30, 35 there, where excessive use of alcohol, especially the hard drinks, is leading people to actually become diabetic, and you can actually even lose your life. The other thing is, as I said, is we are geared as human beings to do things that are pleasurable. So to work on getting a balance between things that are pleasurable to you but are not detrimental to you. And I think that's where we come to the subject of having hobbies. I know many of us had hobbies in high school, in campus, in college. And perhaps when you become a parent and you're working, you might think, now I'm too busy to have a hobby. Hobbies are healthy outlets for people to do, whether it is playing football, watching TV, listening to music, things like that. It's very, very helpful in terms of giving you space to unwind so that your body and mind and soul are healthy. The other thing is doing things in the community that bring meaning to your life and also bring meaning to others. That's very, very important. I believe I have answered most of the questions that Mr. Wangaji posed to me. The detox, by the way, is normally 10 to 14 days. And if somebody is severely addicted, for example, to alcohol or to marijuana or to other things, then they would most likely also need a 90-day rehabilitation program. Thank you. Over to you, Mr. Wangaji.
Thank you very much, Dr. Ketch. Now we know we are fully informed, and we now open the floor for questions. We have the following questions from Anonymous. How many times do you allow the employee who relapses following multiple rehab sessions?
Mr. Odero, please answer that for us.
Yeah, employee based on the policy, that one will be handled administratively, and through HR, it will be looked into and will be guided individually.
Second question is, do you have any sanctions on employees, such as termination of employment for such staff?
Based on that, still will go administratively, and if there be need, the board will be constituted.
Mr. Wangaji, if I could also add what Mr. Odero has said. Hello? Mr. Wangaji?
Yes, hello?
Hello? May I contribute, Mr. Wangaji?
Yes, by all means, you're welcome.
Yes. So
Go ahead.
I was saying that in terms of how many times somebody can go like for rehabilitation before a disciplinary action or something like that is taken, each organization needs to have an alcohol and drug substance abuse policy that will guide them on how to handle such cases. I believe in KNH, it used to be 3 chances, and then after that, you would face a disciplinary committee. That might have changed, but the last time it was either 2 or 3 times, and I believe it's 3 times. And also remembering that it is a brain disease, but you also must have, there is the role for the employer in terms of giving access to treatment and prevention, but there is also the aspect of the person who is affected in trying their level best with getting support on how they can also work towards their recovery. The other thing that I forgot to mention is that, of course, there are also other resources outside of the hospital, outside of our workplaces, such as Alcoholics Anonymous, Narcotic Anonymous. There are a number of 12-step programs internationally and locally that can really help somebody and support them during this journey of wellness. The other thing that I think is very, very important for employers to consider is that it's important to have green areas and areas where employees, or spaces where employees can chill out, where employees can sit and relax. They can have a moment, even a breather, whether it is within, like in your compound, within your working area. And then also, as employees, it's just sometimes there are things that you can do for yourself that will help you to remain mentally healthy, such as eating mindfully, taking mini breaks, maybe a 5-minute break, just look away from your desk, stand, walk around your office, and then do something different. It's very helpful. Thank you.
Thank you, Dr. Ketch. Is there any other question that has been answered? Dr. Ketch? How do you? Yes. How do you tackle withdrawal symptoms? Dr. H, if you may.
Withdrawal symptoms are tackled medically. That's why one needs a detox in a medical facility where you're given medication that will stabilize your brain, will stabilize your nerves, will help with sleep, and will also stabilize your mood. So it is handled medically, and there are standard protocols for doing that, and that is usually very, very helpful to anybody who is affected.
There is this other question. How do you ensure managers refer newly employed employees to EAP before they land into disciplinary process?
First of all, at the entry point when they are newly employed, we have what we call orientation and induction. And through that, we take them through what is there, the do's and the don'ts.
Thank you, Wanodero. Well, I think yes, thank you very much. I think we are through with the program. If one has any further question, probably you can forward them, then they will be tackled on an individual basis. We are glad that you attended and found time to attend the program, and we look forward to the third series of the same presentation. And thank you very much. Dr. Ketch, if you have something to add.
Thank you, Mr. Wangaji, Mr. Odero. That was an excellent presentation, and thank you for moderating us. I really want to say a very, very big thank you. Today we had over 1,000 participants attending this program, this webinar, meaning that this is a topic that people are very interested in. Now, one thing that Mr. Odero might have mentioned is that, and I have also mentioned it, is if you find that you're experiencing excessive fatigue, excessive low energy, you're getting easily irritated, you are getting mood swings, lack of interest in things that you used to like before, or if you're on the other side where you're finding that you're hyperactive, you're spending your money and your time in a way that's detrimental to your life, it then means that you might have an underlying mental health disorder, and you need to reach out to your employee assistance program, to a psychologist, to a psychiatrist, and we'll be there for you. I myself have lived experience of living with depression and anxiety. It has been quite a journey. One of these fine days I will write a book, but I also want to say that I've reached where I am because of the excellent peer support that I have had, and even excellent treatment that I have had, not so that I'll be able to function despite going through one or two health challenges. And to everybody who attended, a very big thank you, and looking forward to you joining us in our next webinar. If you have any other questions, Mr. Odero's number is there on the poster. And thank you so much, so much for joining in. You made our webinar wonderful. Asanteni. Bye.
Mine is just to thank you. Let's be objective and support, as I mentioned, that alcohol and drug substance abuse affect us negatively beyond our workplace. So let's take care on that, and let's take care of our families so that we build a strong nation, a strong continent. Thank you very much.
Thank you very much.
Bye, everyone. Have a good afternoon.